So welcome into the new, remodeled, rejuvenated Psych with Mike library. And you actually have been traveling.
Yes, I was traveling again. I retired, and I believe that retirement facilitates travel, and I recommend it to all my old friends.
But I didn't tell you that that we were going to do this. So you walked in today and you were surprised.
Duly impressed.
Good.
Yeah.
Oh, you were impressed.
I was impressed. It's not dark and dungeon like it was before.
Well, that's nice. And for those of you who get Psych with Mike as a podcast, you obviously can't see the revised, rejuvenated, remodeled studio, but you can go to YouTube and look Psych with Mike up and you can see it there.
So should I assume that this is a reflection of our success?
Yes, absolutely. You should assume that. And everybody who is listening to Psych with Mike should also assume that.
All right.
Yes, we are very successful.
Yeah.
At least, you're supposed to dress for the job you want, not the job you have, right?
Right.
Yeah. So I feel like that's what.
So I've been wearing a swimsuit for the last week, hoping I could be a lifeguard somewhere.
Yeah. So I am actually really excited about this. I want to throw a shout out to Mrs. Psych with Mike and daughter Psych with Mike, who were actually integral in helping with the remodel effort. They did the painting of the studio and also with a lot of the work in setting things up. So I'm very pleased with the way it turned out, and I'm glad that you like it.
So I have a question about that. If Mrs. Psych with Mike was integral to...
And her name's Kim, you know who she is.
But I was going to not make that reference. If she's integral to this whole process and she's sort of given birth to it, and I wonder would she have postpartum depression as a letdown after she finished doing all the work?
She's probably depressed as a rule living with me. But that is actually a very good, very valid, very fair question.
I'm a professional. I can do this. Yeah.
Yes. That's a great segue. We are going to talk today about postpartum depression. And the reason why that was something that I wanted to talk about today is because in real time, we are seeing a lot of states pass laws having to do with more restrictions on abortion, and even with the goal of eventually getting to the Supreme Court overturning or at least challenging Roe v. Wade and throwing out a woman's right to choose and mandating that abortion be reinstituted as an illegal procedure. And that really got me to thinking, because I am very aware that for me, in my theory of psychology, all emotional regulation develops in the first 2 preverbal years of life. And so the emotional quality of the relationship between mother and child during that period is eminently important. And if you have lots of children who are going to be forced to be born to women who really didn't want them, and not that that is a bad thing for those women, certainly there are any number of rational reasons why a woman could be in conflict over her pregnancy, but that's going to have a real impact on the emotional quality of life. And one of the things that is not only underreported in our society, but would, I believe, be exponentially greater if we were to make abortions illegal, would be this idea of postpartum depression.
Well, it's fascinating to have this as a topic of conversation, because both of us are dedicated to the premise that this is a clinically based show, and we want to talk about the clinical concerns, not the political ones. And so while there are many political arguments that can be had and are being had around the topic.
There appears to be a duck in the studio.
There's a duck in the out by the pond.
Yes.
What we want to do is talk about our perceptions regarding the clinical issues. And as you said, if you have a woman have a baby, it is not uncommon that shortly after the birth of the baby, she goes through a depression. And typically, it's referenced or called baby blues, and usually it self-corrects within a week or 2 of delivering the child. But what we're talking about when we say postpartum depression is a more severe and extensive depression that limits her emotional availability and her emotional expressiveness and her ability to bond with the child. And she sends those nonverbal messages of unacceptability and dislike even to the nonverbal child. And we've both studied attachment theory pretty extensively. And the idea is that the baby, even at birth, within a couple of days of birth, is starting to look around and look for some connection, some response. And initially, they only have nonverbal ways of communicating their needs or their emotions. And a lot of that's through crying and smiling. And they can, and there have been lots of studies done, lots of videos taped of little babies being really seductive and flirty and cute, so that they can attract the attention of what psychologists call the object. Usually they're calling the mom. And a mom who's not emotionally available to respond to that, when that happens, then the baby doesn't get the nurturing that it needs, or the bonding or the attachment that it needs, unless there's some other adult who's there frequently enough and long enough to make that bonding situation occur. Because babies need that. Otherwise, they experience, I mean, there are different theories about how to some of the access to disorders develop. And early in childhood, the belief is that there's a splitting that occurs when the child has to develop a seductive persona to entice positive responses, and then they have another persona that they develop, and like a totally different personality. And I'm not talking about multiple personalities, which is a different thing. When that's not available, and they switch back and forth. And so good self is there when good object is there, and bad self is there when bad object is there, or non-available object is there. So we thought we'd try to explain some of those concepts to the audience today.
And there are two things that while you were talking about that I want to give labels to. So there's two different qualities of that interaction between mom and child from a developmental psychology perspective. So there's social referencing, and then there's social reciprocity. And when the child smiles and mom smiles back, and then the child smiles and the mom smiles back, that's social reciprocity. So that is when the child's interactions affect the mother and the mother's interactions affect the child, and that goes back and forth like a ping pong match. And that is required for the child to be able to feel connected to
I'm in my 70s and I still play that game with you.
Yes.
And I smile at you and you don't smile back.
Because I'm very bad at that. Because I didn't learn it when I was a baby.
I wasn't going to say that. Yeah.
And then the second one is social referencing. And social referencing is the more important aspect and quality. And that's where the baby looks to others in its environment, particularly the primary caregiver, and looks at the primary caregiver for clues for how to receive and interpret emotional information. So the baby is looking at, and that's when you talk about the object, that's that quality of looking at and idealizing that external object. The baby is looking at the model that the primary caregiver is demonstrating, and then the baby is going to replicate that behavior, and that's the introject. That's when the baby takes that information and makes it a part of their own psyche.
A good example of that is when a child is less than 2 and they are trying to stand and they fall or they bump their head or what have you, and all the adults in the room who see the baby fall go, and the child looks around and figures out, I'm supposed to be distressed, and then they cry or they act out. But if you watch, you can see them look around for an indication of, and if you're able to see that happen and say, brush it off, bounce up, that's you're okay, and not have that panic reaction, then they just go on about their business.
Right.
But if you have, or the other people have that panic reaction, then they cry for soothing, because they don't have the ability to self-soothe at this point. They have to be soothed by external means. And so that's when you have grandmother come over and she's not been around babies for 50 years, and this happens and she goes into a panic mode about the baby, about anything. Something gets knocked over, oh my God, and they're yelling and carrying on. Then the baby learns to respond to that appropriately. Right.
And a great example in my own personal life was when my daughter was very, very small. She was staying with my wife's sister and her husband. And one day her sister called me up on the phone, and she's just distressed. She's crying, she's bawling, she's like in a fit. And I said, Mary, what's going on? What's going on? She's Jenna, and my daughter, just for self-disclosure, has rolled out of every single bed that she's ever slept in. That was just what she did. If she was asleep, she rolled out of the bed. And so my wife's sister calls up and she's like, oh, Jenna just rolled out off the couch and she was sleeping. And I said, Mary, calm down. I said, is Jenna crying? She said, no. I said, well, then why are you? She said, I don't know.
Yeah.
Because, she was distressed, but my daughter was fine. That was just what she did. She just accepted that as a given. She rolled over a lot when she was in a bed. And if we didn't have rails on the bed, she rolled out of it.
Yeah.
So that's exactly a prime example of exactly what we're talking about. But when we talk about this postpartum depression, so baby blues is something that is very, very common, not only in females right after birth, but also in males. So dads oftentimes very frequently experience baby blues because there's a real change in the dynamic of the relationship between mom and dad. There's a change between the daily schedule. I mean, having a child is a big change, especially when it's a first child. And so oftentimes that disruption takes a little while for everybody to work through. That's not uncommon.
Oh, there's for the first 2 years at least, there's a lot of data that supports that husbands and wives get more tension in their relationship, especially because the mother can't nurse two babies. And so the husband wants attention. I mean, he's somewhat reasonable for the first few weeks, but then it's kind of like, okay, we've done this baby thing. Now pay attention to me.
Right.
And she doesn't have the energy to do that. So then he gets mad at her and says, you don't love me anymore. And he pouts and he's angry and what have you. Now, whether that's an outgrowth of baby blues or whether that's some other issue, we can talk about all day long. But it does happen in many situations.
But as you pointed out, the baby blues usually resolves itself within a week or two, at the most a month.
Right.
And those kinds of things, even though they can be distressful for a new parent, are not necessarily integrally disruptive to the child's development.
Right.
So those things are okay. But in a more profound presentation, which we call postpartum depression, this actually becomes an issue that makes it less likely that the mother is going to be able to interact emotionally, efficiently, effectively with the child.
So I just spent a considerable amount of time with a 9-month-old baby, which I haven't done in years. And I was watching the people interact with the baby, and every time the baby was awake, somebody was trying to entertain the baby, get the baby's attention, play with the baby, soothe the baby, whatever. And I kept saying to them, there's a point at which the baby has to learn to self-soothe.
Exactly.
And so the second that they cry in the morning, that they're awake, doesn't mean you have to stop whatever you're doing and run in there and get them. I mean, they will let you know when they really need attention. But if you don't teach them that the instant that they're available, you will occupy all their attention, then they have to figure out what to do with themselves. And they learn to be aware of their surroundings. They learn to play. They learn to distract themselves and investigate things instead of demanding your attention so that they feel anchored. And it goes back to the whole attachment thing. But that's a dance that you do over time as you raise a child. It's called separation individuation. And they have to separate from their sense of oneness with the object, the mother usually, again, and become themselves. And they have to be okay and not panic if mom leaves the room. And around 9 months is when they develop object permanence. So they have the ability to know that if you leave the room, you're going to walk past the door, at the other end of the room, or they're going to be able to see you, or if the phone rings, that they'll hear your voice. And so they have to learn that something that they lost sight of still exists in the world.
Right.
And will come back.
So let's then define a couple of terms that we've been kind of bandying about, but we haven't really delved into.
Is bandy a professional term?
Yes.
Okay.
Yeah. Because I just said it, so it is. There is a difference between what we call bonding and what we call attachment. So bonding is a biochemical process that happens right after birth. So when the baby is in the womb, the oxytocin levels, which is a hormone, a prosocial hormone in human beings that makes us feel good, are very highly elevated for both mom and baby. This is also true for dads. just before birth. And that's why when a child is delivered, if it is possible and there isn't a threat to either child or mom, they will always, the doctors and the caregivers will always try and get the baby in skin-to-skin contact with the mother and with the father right after birth, because that really solidifies these elevated oxytocin levels. And that leads to what's called bonding. So bonding is that biochemical or a biochemical connection that happens right after birth. That's different than what we call attachment, which is a socio-emotional connection that happens over time. So we would love to have our children bonded to us. Obviously, in adopted situations, that can't happen because you're oftentimes not there. If you are there and that process can happen, that is fantastic. And I would encourage it if it is possible. But bonding is something that happens that is a biochemical process. And while bonding can happen, it is not required for what we call attachment. And when we're talking about postpartum depression, that postpartum depression really affects the quality of that attached relationship that is developing over time, especially in those first 2 preverbal years.
Yeah, my son is adopted, and we live in Missouri. And Missouri has not historically been adoption friendly.
Mm-hmm.
So when his mother was about ready to give birth and we were working with the state on the adoption process, they said, you can't have him initially, even though she's surrendering rights to him. He has to go into foster care, and you can have bonding visits over 6 months to a year before we finally decide to give him to you. Fortunately, she went to visit her grandmother in Illinois, Granite City.
Yes.
And she went into labor, and the baby was born in Illinois. So the laws of Illinois
were different.
Are much different. We got the baby 3 days later at the hospital, and he's been with us every day of his life. So he didn't bond to foster care providers.
Yes.
He bonded to us. And that is a much better way.
Yes, absolutely. But in postpartum depression, and just for people who may not know the prevalence of this, according to the CDC, the Centers for Disease Control, postpartum depression is an actual artifact that happens in the lives of between 12 and 20% of mothers. So it's actually, maybe 1 in 5 women are experiencing this profound sense of disconnection to their child that's associated with postpartum depression.
That often lasts more than a year.
Absolutely.
So we're talking about a 2-year window. Yeah.
And these women oftentimes feel like that they're bad mothers because they don't feel connected to these children. And in reality, this is something that is controllable.
Well, and in effect they are, because of the impact on the child, but not through any maliciousness or willfulness on their part. And actually, there's some good news. As we were preparing for this, I read that just in March of this year, the FDA has approved a new drug for postpartum depression that seems to be really having a significant impact on reducing the symptomology. And the drug is called brexanolone. And Washington U has been doing a lot of research with it, and they've been doing other research that they report has really good results. So,
and you were telling me that is actually an intravenous drug. It's not a pill that you take.
It's a neurosteroid, and they have to give you injections for it.
And so for me, and I think probably for you as well, because our history is in psychotherapy, talk therapy, I believe that psychotherapy can be very, very beneficial for women who are experiencing.
I would recommend a combination of both.
Absolutely.
Absolutely.
Yeah. And, the goal of psychotherapy when you are treating someone who is experiencing this is at least for me, when I work with women who are experiencing this, is to help the woman, and if the father, if he would like to be a part of it, to feel competent as a caregiver for the child, and to really try and help them to nurture the emotional connectivity between mother and child as much as possible, and to feel good about that, because that way they're going to be socially, in that social reciprocity, they're going to be reflecting back to the child a sense of connection that then helps the child to feel connected to the parent.
Yeah, well, we've certainly seen the results in our careers as therapists of fathers who went to work and left parenting to mom in the younger years, especially toddler and grade school years, and then come in when the child is 12 or 13 or 14 and demand their respect and their responsiveness, and they haven't put in the time. They haven't earned it. And their intellectual thing is, well, I pay all the bills, I bring home the money, and their complaint is, well, they just see me as a wallet. They don't really embrace me emotionally in the way that I want them to. And my argument always is, you got to be there when they need you.
Right.
You got to change the diapers. You got to feed them. They have to learn they can rely on you as much as they can rely on the mom. And you have to give them emotional nurturing. Are you capable of that?
Right.
No. Then you need to learn how to be, or you need to practice it so that the child experiences it. The proof is in the pudding. How does the child respond to you?
And the people talk about the difference between quality time and quantity time.
Yeah.
And quality time obviously is better than quantity time.
Yeah.
I mean,
well, if you're in the room but you're reading a book or watching a sports game.
Right.
Yeah.
But quantity time, when you are talking about children, is important. So, for people who say, okay, well, I have a job and I travel for, 360 out of 365 days a year, and obviously that's probably overkill, but you travel, 180 days out of the year, and that's your job. Okay, that's fine. And, hopefully the time when you are with your child, you try and have as quality an experience as possible. But the truth is, if you could have more time with your child, that would be better. It's better to be with the child, and as long as you can try and be connected
and
to the child.
Potentially better for both of you because of the reciprocity.
Yes, right. So you have to be with the child, you have to be attending to the child, but you don't have to be entertaining the child. So it isn't that you have to be the circus master. You just have to be in the room and actually paying attention. So you can actually even be watching TV as long as you are interacting with the child.
Yeah.
But if the child is sitting down playing with blocks and you're watching TV and the child is in a separate reality than you are, that's going to feel very disconnected. But if you are in the room and you are interacting with a child who is playing with blocks, because children experience what's called parallel play, where they're in the room with another person and they may not be doing the same thing, but they feel interactive because they feel attended.
Yeah, and so you don't have to be watching SpongeBob
Right.
or Sesame Street or some child-oriented thing, but you have to be interacting with and responding to the interactions of the child.
Right. Which goes back to, if you have this postpartum depression thing happening, you may not be capable of being able to engage in those kinds of behaviors. And that's when, so for me, if a woman is, or even a man is feeling disconnected emotionally from the child, if they find that they're crying a lot, if they have changes in appetite or sleep, and just overall just feel lethargic and sluggish, don't even ask yourself, do I have postpartum depression? Go see a qualified professional and talk about it.
Absolutely. And they will often identify themselves by saying, what's wrong with me? I don't like my child.
Yeah.
I'm not drawn to that. I don't want to attend to him. I don't want to play with him. Of course, the ancillary comment to that is the partner then needs to step up to attend to the child so that the child doesn't fall between the gaps. But the parent who's experiencing the postpartum depression needs help in getting past it, because you've got to get past it as quickly as possible.
Right. So hopefully that conversation was helpful for people. If you have any questions or comments, if you want to let me know, if you watch this on YouTube, let me know if you like my Sigmund Freud action figure that is in the shot, because my Mrs. Psych with Mike does not. Give me some feedback on that. Send us any questions.
I still think it looks like Robert E. Lee.
I know. Send me any questions that you have to psychwithmike.com, and all of the music that appears in Psych with Mike is written and performed by Mr. Benjamin DeClue. If it's Friday, it's Psych with Mike.